All right, Sport and Spinal Weekly. Here we are. Another week in the studio with us this week. Dr. Erickson. Of course, Jason Brodina with Choice Therapy will be up later. But wow, it sure is a nice week, which means people take advantage and get outdoors.
It is unbelievable out there, and it just keeps coming, getting better and better.
And everything's changing. The time of season.
Yeah, it's beautiful, and the thing is, it probably is not going to last forever, as we know. So it's a good time to get out and enjoy things, get out in the woods, and pick up some of those hobbies that maybe you wanted to get out and do for a while.
Mm-hmm. Plus, that brings the deer for some weird reason to the side of the road. Fall does.
Yeah, they're
Somebody
out,
needs to study that phenomenon.
It is. It does happen every year. I don't know. Someone just told me it makes sense that there are more people like hunters in the woods and things like that with grouse hunting and bow hunting and things of that nature. And maybe pushes them around. Maybe they're looking for things to eat.
Grass is always greener on the other side of the ditch, they say. Right?
They do say that.
So we'll talk about those pesky deer, and among other things, on another edition of Sport and Spinal Weekly. More when we return. Sport and Spinal Weekly, we are back. Remember, you can go to the website and get all of the information we talk about every week, and then some, plus podcasts and a plethora of information. Your ailment is, the cure is possibly be waiting, certainly at the clinic, right?
Well, it's a good resource to use, sportandspinalrehab.com, and it's certainly not going to get all the answers for things, but if you have a general question, you might be able to find that kind of on, there's different tabs where you can look at different health conditions. Mm-hmm. And then there's actually a pretty cool thing. You can actually just email our clinic right from that website, which is easy to do as well.
Right, and there's probably a contact number if you had to talk to them. They have people that answer the phone for real.
Yeah, that we do.
No automation there. I was pulling out my pedometer, or what I like to call a pedometer. And I put this on at 6 o'clock this morning. It must have reset. I thought for sure. I was at 1.6 kilometers at 10.
That's good.
That's a lot of walking. I guess a person doesn't realize how much walking they do.
You do put on some feet during the day.
Well, and we're talking about walking. Most of us do that outside, and folks are heading outside. And we were just talking off mic that a number of hunting options, from guns to bow and arrow, right? Is that started up, or is that coming up?
I think that's October
1st?
That has started up, bow hunting, archery for deer, and upland game and things like that. And I guess, we were talking kind of about the deer thing, and people might say, well, how does that relate to Sport and Spinal Weekly or chiropractic care and whatnot?
And we listed, it's like, what is it, 10 degrees from 10 separation from a deer?
Yeah.
We have hunting to getting the shack ready to trying to avoid a deer.
Well, it's amazing. Just in the last couple of weeks, in our office, we've had many patients with things kind of related to going out and doing just stuff in the fall, whether it's yard cleanup or, which I think we talked about, and injuries with that, but more specifically walking in the woods, maybe doing deer hunting or grouse hunting or bird hunting. You're bending, twisting, lifting, those types of things. You're maybe walking a little bit more than you usually do. If you're a bow hunter, you might be climbing deer stands or mounting deer stands, things like that. So it requires some different mechanical muscle movements. If you're lucky enough to shoot a deer, you're going to have to clean the deer and then haul it into your truck and handle it. So there's some chance for injury of the back. But I think maybe the one that's overlooked, and not really overlooked because we see them all the time, is like you said, on the side of the road. Mm-hmm. And
not hunting for them.
Not hunting for them.
Avoiding them.
Trying to avoid them. And we see so many patients in our office that come in, and I'll ask them, what happened, and they'll think, oh, it's just kind of a minor thing. Oh, I swerved for a deer, or I hit a deer. But it's amazing the amount of force that your body can withstand when you hit a deer and encounter. And of course, we've talked about this before with the insurance folks on the program, and it is that is fully covered by your insurance if you go and go to a medical provider and get some care done. if you are injured in a car versus deer collision. So I just want to encourage people to get checked if you are injured, or if you think you're injured, or if you even hit a deer and you think, hey, my neck feels a little funny, or my back or elbows or shoulders, go get it checked out and see if you have some injury.
Well, yeah, you might even have whiplash or concussion. You don't know.
Yeah, well, if you think about it, if you're traveling 55 miles an hour and you hit a deer, the first reaction is obviously to slam on the brakes, and so you can imagine that force is you're gonna whip your head forward and back, just doing that. So, and typically when you hit a deer, you're not braced for that impact. It comes real suddenly, and then if you swerve to avoid the deer, which most people recommend hit the deer instead of swerving to avoid it. If you do happen to swerve and hit the ditch, certainly then you're going to, the chances of getting injured are pretty high.
Right, they probably increase 2 or 3-fold, I would imagine.
For sure.
Because all that inertia's got to go somewhere.
Exactly, and so many people think, well, my car wasn't damaged that much, or, the deer maybe wasn't damaged or killed or even hurt, but yet still you can endure some damage just from stopping or moving real suddenly in the vehicle.
And I remember in talks where a whiplash can trigger different ailments or conditions that you might feel you have, or a headache or different things.
Yeah,
right?
And whiplash is, whiplash is a term that is kind of coined as from a collision where your head kind of whips back and forth, your head and neck, and we can't get into the anatomy and physiology of exactly what happens, but in a nutshell, basically it's a sprain strain type of an injury with the neck. So similar to if you would sprain your knee or sprain your ankle, but it happens with the joints in your spine instead of let's just say your ankle. And most people are familiar with an ankle sprain. When you sprain your ankle, it twists beyond the normal limits of what your body can do, and that's basically what your neck does in a whiplash condition. So with that, you injure some structures there in the neck, and that causes pain.
But you could get whiplash slipping on the ice, right, and
Sure.
bouncing your head off the cement, right? I mean,
absolutely.
It's not like you have to be in a car accident.
No, it's
where 2 cars collide at 50 miles an hour to have whiplash.
Exactly, and so the term whiplash is being kind of replaced in the medical community, but with we call it cervical deceleration injury. So basically, your neck accelerates and decelerates. That's what causes the injury. But whiplash is real common, and it does kind of makes sense as to what happens with the neck.
It's a lot easier to say, Doc.
Yeah,
what do you think?
It's probably easier to say.
Acceleration, deceleration.
Yeah.
Sounds like you're braking and accelerating with my neck.
Yeah.
Basically, that's what it is,
and
right?
That's what it is. So the point is that if you're out, and everybody's seen them. I've seen tons of them along the road. The deer, and they're out and about. So you got to keep your eyes open. Number one, and if you are unfortunate to have to swerve and miss one, or unfortunate enough to hit one, if you're having problems, please go get it checked out. Because again, we're fortunate in Minnesota to have insurance that will cover that.
Well, we have so many darn deer. I've seen people try and swerve to miss skunk too.
And skunk as well. I agree. There's lots of skunks on the road as well, for sure.
Well, I know that folks are going to be out. I've already Sheriff was just out. I was talking to him on Monday, out in the woods getting ready. And you brought up, putting up deer stands and getting the shack ready, twisting and turning, and that's when we do it, right?
The rule of thumb, and we've talked about this, safe lifting habits. Use a wide stance technique when you're lifting. Put your feet wider than shoulder width apart. Bend with your knees. Keep your back straight. Try to avoid bending and twisting and lifting, because that's those are the two that get you, the 3 components of an injury that'll get you every time. And so if you can avoid those things, and one of the problems is that when you feel good, you don't think about doing things correctly mechanically.
You just go all out, right, Doc?
You just go for it.
Tackling it.
And that's when injuries happen. So
maybe even slow down a little bit.
Then you can slow down, and that's one of the things when we do back safety talks is take a look at what you're going to do, what you're going to lift, what you're going to move, and then say, okay, what's the best way to do this? You don't have to sit and study it for a half hour, but kind of take a look at it and say, what would be the safest way to lift this component, whatever you're lifting or whatever you're moving. So just some techniques when you're out in the woods and enjoying the beautiful colors, and you certainly encourage people to get out and do things and enjoy this beautiful weather while it lasts.
And be safe. Dr. Erickson, thanks for coming in.
Oh, thanks for having me again, Mark.
We'll be back after we talk with Jason Brodina. We'll wrap up today's show. This is Sport and Spinal Weekly. Sport and Spinal Weekly. We are back in the studio with us, Jason Brodina, Choice Therapy. Good morning.
Good morning, Mark.
Thanks for coming in again. We're talking outdoors, and we've been outdoors from the deer stand to the front yard to, and you brought up, we're talking today, some of it, a lot of it will relate to anything outdoors or even indoors, but for that matter, you guys are teamed up with youth football, and you guys are seeing some knees and ankles.
Yeah, us at Choice Therapy, we run the youth football medical booth for 3rd through 5th graders, and we have been noticing a lot of knee and ankle pain in those kids. There's many types of knee type of injuries, but I'll just throw one statistic out at you.
Okay.
They say that 9.4 million visits to physician offices in the U.S. per year are for knee pain.
Wow, that's a lot. Knee pain.
Knee pain. So you get a lot of people that are going in for knee pain, and there's lots of different types of injuries for the knee. One of the common things that we see in people is what we call, you've heard of maybe jumper's knee or runner's knee.
Okay.
The medical term for that is patellofemoral pain. Ooh, big long word.
It sure is.
What it basically means is that the kneecap tracks in the wrong place on your thigh bone, and it causes rubbing of bone on bone.
Ouch.
And that's where people get that pain. Usually it's caused from a muscle imbalance. So there's 4 different parts to our quadriceps muscle, the muscle in front of our thigh, and the inside part of it can get weak. And if that inside part is weak, that kneecap will track in the wrong spot and cause knee pain. And if you quit doing the activity, it'll get better. And then you'll rest, and then people will say, I just can't do any activity because every time I try and exercise or do anything, my knee starts hurting. Well, more than likely, that resting that you're doing can be increasing the problem because your muscles are getting weaker and weaker.
So it's like an underdeveloped muscle.
It's a very underdeveloped muscle, and so that muscle helps to pull that kneecap into the right groove. So we'll see a lot of that in our clinic of trying to rehab that knee by strengthening that inside part of your quad muscle to allow the kneecap to track properly.
I see.
We also see that type of injury of the knee pain in a lot of young athletes, especially around that 12, 13, 14 years old.
As they're developing these areas.
Well, what happens is their bones grow and their body structure gets bigger, but their muscles haven't developed yet. So then they get this weird knee pain every time they try and play sports. Some of the sports that cause this type of knee pain are a lot of the cutting type of sports.
Soccer, football.
Soccer, football, basketball, jumping, cutting, running. Those are all the things that we see with this type of knee pain. And so instead of having your kid quit that sport, come and see us.
Yeah.
We'll do a free injury screen. There's a lot of different things that we can do.
Well, you'll develop that muscle, right?
Yeah, and it usually takes like 3 to 6 months. But we also do some taping techniques as well. We'll put on what we call some McConnell tape to help pull that kneecap over so you can still play that sport.
But you're going to have a little pain.
You're going to have a little pain, but
till you get that developed.
Till you get that developed. But with that taping, sometimes we've been able to decrease that pain by 50 to 60% so the kid can continue to play that sport.
At a higher performance.
Yet continuing to rehab, and so they don't. We want to build up their strength so they don't have to wear that tape their whole life. But for the short-term fix, there are fixes that we can help to get you through this season.
There you go.
So there's a lot of things that we can do. You'll see a lot of different types of knee pain. Like I said, we've seen a lot of ankles too. You want to relate it back to deer stands, we see a lot of people around November that are walking in the trees, haven't done anything for 11 months, and say, oh, I stepped on a branch, and boy, my ankle just twisted. So there's a lot of injuries that we see when people are starting to get outdoors and enjoying the outdoors.
I suppose us that are older, we haven't been developing for a while, not taking away from those that are active and healthy and don't have the problem. They probably don't come in with sore ankles, but those of us that get out a few times a year, and some guys and some gals too, they get kind of excited when you get out in the woods, right?
Yes.
And you just kind of overdo it sometimes, and I could see where ankles and stuff like that are.
As we get older, whether we like it or not, our sense of balance or our balance decreases. And if you step on a twig, a younger person will be able to react to that and nothing will happen. As we get older and our sense of balance isn't there, and then you add inactivity on top of that, we see a lot of twisted ankles, twisted knees, sprained ankles because of that inability to balance and that inactivity.
How about shoulders from those archery guys? Are they working it pretty good?
Yes, we see shoulder injuries all the time for bow. Actually, that's once you get strong, that's a good way to keep up and maintain your strength in your upper body and into your shoulders is to bow hunt and shoot archery. Shoot archery in the winter in the archery range here in Bemidji to keep up your upper body and your shoulder strength. We see, I guess I see probably 2 or 3 bow hunters a year that come in and say, I tried pulling my bow back and now I can't. Well, we've rehabbed those people and get them on an exercise program so they can get back to bow hunting as well.
Well, I suppose you guys could actually go the other way, and to enhance performance, you could help them out to where they could pull even more pounds, correct?
Yes, yep, we can try and build up their strength. And, if anybody out there ever wants to take me out to the field and I'll help them out there, more than willing to do that.
There you have it. A fun time in the woods. And you're working.
And we're working.
That's right. Jace, thanks for coming in. And now, how's everything going up in Kelliher, North Home?
Kelliher North Home is going great. We have some great therapists over there. They're continuing to stay busy. Bagley and Clearbrook, they're really busy as well. So we've thank you everybody out there that is coming to see us in our outreach clinics and in Bemidji. Hopefully we're doing a great job for you and servicing the needs that you bring to us.
Awesome. A website?
ChoiceTherapy1.com.
Jason, thanks for coming in. Sport and Spinal Weekly, we are back. I'd like to thank Jason Brodina coming in from Choice Therapy and Dr. Erickson in here this week. Are you been getting out in the woods? Is it going to be your plan this weekend?
The plan is to hopefully spend a little time in the woods.
All right.
Yeah, and get out and enjoy. The colors are I think they're at their peak right now. Mm-hmm. And of course we know that obviously it's real dry, so we have to be safe with with the fire stuff as well. But because it's dry, those leaves I don't think are going to last too long either. So
better get out there.
It'd be a great time to get out and enjoy that nice fall weather.
And the tip this week?
Well, just that. Get out and enjoy things.
Oh. Well, that's an easy one.
That's an easy one. We're just, it's not, and I think it's good for the body to get out and get some fresh air. Good for just smell that fresh air, get some exercise, get the blood flowing a little bit, and because again, this stuff's not going to last forever. So
yeah, we know what comes after fall, and it's not spring.
That's right. We got one section there in between.
Dr. Erickson, thanks for coming in.
Okay, thanks, Mark.